One of the most dangerous complications and costly complications of diabetes is what we call as the diabetic foot syndrome or the diabetic foot complication. With a florid gangrene, the whole leg had turned gangrenous and we had to do a below knee amputation. One of the most dangerous complications and costly complications of diabetes is what we call as the diabetic foot syndrome or the diabetic foot complication. It may start off very simple. You may just have a little callus or thickening of the skin under your foot. You may have a small ulcer which starts, but it's like a fire. There's nothing called as a small fire. A small spark is enough and a whole building can come down due to that. Diabetic foot is like that. It's an emergency. So you may just have a little coloring difference in your foot. You may become little bluish or blackish, or there may be a callus, or it may be an ulcer, or it may be a decrease in the blood circulation to the foot. This can lead to a diabetic foot ulcer. Now, if you treat the diabetic foot ulcer early, and if you control the diabetes well and you do all the right things, you get to the doctor early without delaying. On the same day when you detect something, don't delay even by 1 day, because 1 day can be very costly in the case of diabetes because it can spread. It can be a very dangerous condition. Now, there was a patient who came to us, and I remember he was from Sri Lanka, and this was a young man, he was about 30 years old, but he was a chronic smoker. And what happened was that he had an early gangrene which was setting in. He was a smoker and he had diabetes for quite some time. So we told this man that it's difficult, we will try our best to save your leg. Somehow, thank God, after good control of diabetes, after giving some medicines to improve the blood circulation, after doing an angiogram and finding out that where the blood circulation was and treating it and so on, we were able to save that man's leg and prevented the amputation. Then I told him, look, if you smoke one cigarette a day, again your problem may come. And next time we may not be able to do anything. He promised me saying, no doctor, I will not smoke. This is a miracle which has happened. You have saved my leg and so I will not smoke. He went away back to Sri Lanka. 1 month later he came back. His leg had turned completely gangrenous, and then he is telling me, doctor, I could not stop smoking. Let me be very honest. I started smoking very heavily. Even though you warned me, I have developed gangrene. I knew I am going to develop gangrene. I still could not stop smoking. You cut off my leg, doctor. That is better. So the man to whom we have told him there's a chance that you lose your leg, we had saved his leg with God's grace, of course, and then he promised that he will not touch a single cigarette after that, started chain smoking after he went back, and within a month came back with a florid gangrene. The whole leg had turned gangrenous and we had to do a below knee amputation to save his life. Otherwise, even his life would have been in danger. So one of the things that every person with diabetes should do is no tobacco, no chewing tobacco, no BD, no cigarettes, no smoking in any form. Because if you do that, the chances of losing a leg is very high. Apart from developing heart attacks, apart from developing various forms of cancer, losing a leg is definitely a possibility. So please do not smoke. Give it up completely. Otherwise, not only your leg, your whole life itself is in danger. And this particular man, young man, lost his leg, and later on after that he also developed a heart attack and soon after that, few years after that, he passed away as well. So it is like a poison that you're taking inside your body if you smoke. Look after your feet. The feet are given to you by God, and if you look after them, if you look after your diabetes, you can have 40, 50, 60 or more years of diabetes. You can live up to 90, 100 years of age with your own feet without having any diabetic foot problem.